So last episode, we left Sarah standing in front of her supplement cabinet with a whole new way of thinking about what was in there. She'd ask herself the 5 questions. She looked at her labels differently. She'd thrown out the fish oil that smelled like low tide. Progress. But here's where Sarah is now. She's done some research. She's found some higher quality products. She's feeling more confident and she's ready to just start taking everything. And I want to gently stop her right there, because choosing the right supplement is only half the question. How do you take it? That's the other half. And honestly, it's the half most people never even think about. So this is what this episode is about. Dosing, timing, knowing if something is actually working. And that's something I don't hear enough practitioners talking about. What your medications might be quietly taking from your body without anyone telling you. I want to train you how I think as a functional medicine doctor. Let's get into it. I'll tell you something about the patients I work with. Many of them are complex cases. Women who have been through the ringer, years of symptoms, multiple diagnoses, medications stacked on medications, bodies that have been under stress for so long that they've become incredibly reactive and sensitive. And when I say sensitive, I mean it. These women bodies will talk back loudly if you push too hard, too fast. So here's what most people do when they start a new supplement, okay? They read the label. It says 2 capsules twice daily. So they take 2 capsules twice daily. And I get it. That's the logical thing to do. The bottle told you to. But here's the problem with that. The label dose is a general recommendation designed for a general population. It's not designed for you. It's not accounting for your history, your sensitivity, your gut health, or the 17 other things your body is already managing. In my practice, I don't just start at the label dose. I titrate. We start low. We go slow. And we find what I call the Goldilocks zone. Not too much, not too little, just right for the body at this moment in time. Because here's what most people miss. There's a dose that actually makes an impact. Below it, you can feel nothing and assume that supplement doesn't work. Above it, especially in a sensitive system, you can actually make things worse. The goal isn't to find that. The goal is to find that sweet spot. The dose where your body is responding, not reacting. And sometimes that sweet spot looks nothing like what the bottle says. I've had patients who need a fraction, sometimes a quarter, a sprinkling of the standard dose to get the response we were looking for. I've had others who need to go higher than the label recommended to see any real impact. The bottle doesn't know that. Only the body knows that. This is something especially true, and I call this a high impact product. This is where it enters the picture. A high impact product is exactly what it sounds like. Something that, when it's the right fit for the right person, it makes genuinely a significant difference. You know it when you see it. The patient comes back and says something shifted, sleep's changed, energy's changed, brain fog lifted, something that has been stuck for months starts moving. Those products deserve extra respect, because if a supplement is powerful enough to make a real impact, it's also powerful enough to cause real problems if you come in too fast or too heavy. And nowhere is this more true than with methylated B vitamins. Oh, those suckers can be very volatile. Methylated B vitamins, B as in boy, like methylfolate, methylcobalamin, are the active, highly bioavailable forms of folate, B9 and B12. They bypass a common genetic bottleneck called MTHFR, which affects a significant portion of the population and impairs the body's ability to convert standard B vitamins into their usable forms. So methylated Bs can be incredibly powerful, life-changing for the right person, genuinely a high-impact product when the fit is right. But for some people, particularly those who are already sensitive, those dealing with anxiety, those whose methylation pathways are already running hot, too much, too fast can cause real problems. Anxiety spiking, heart racing, feeling wired and terrible at 2 in the morning. It doesn't mean they can't take it. It means we need to find their Goldilocks zone first. And sometimes that starts at a quarter of the capsule, sometimes less. We build up slowly, watching for responses the whole way. That's not timid medicine. That's smart medicine. My general framework, especially for sensitive patients, 1 new supplement at a time. Start below the label dose, take it with food unless there's a clinical reason not to. Give it 2 to 4 weeks before drawing conclusions. Increase gradually only when you're confident there's no adverse reaction building. Your body will tell you when you found the right dose. Your job is to create the conditions where you can actually hear it. Here's something that genuinely surprises people. That same supplement taken at different times can do completely different things in your body. In fact, I'd go so far as to say it like this: timing changes everything. And let me tell you a little story. Okay, let me introduce you to Chase. Chase is 17 and a mama's boy. He's a competitive baseball player. One of those kids who's all in year round, living at the field. He came to me because his recovery was suffering. He was training very hard, eating well, doing everything his coaches told him, but his muscles weren't bouncing back the way they should. So we started talking about glutamine. Glutamine is an amino acid, one of the most abundant in the body, and it plays a role in muscle recovery, immune function, and gut health. Most people have heard of it in the context of athletics. But here's what most people don't know. Taken with a protein as part of post-workout shake or meal, glutamine supports muscle repair and recovery. It works synergistically with the other amino acids to help rebuild what training broke down. Taken on an empty stomach, different story entirely. On an empty stomach, glutamine goes straight to the gut lining. It becomes fuel for the enterocytes, the cells that line your intestinal wall. It supports the gut barrier integrity. It helps heal what we call leaky gut, the breakdown of that intestinal lining that underlies so much chronic inflammation. Same supplement, completely different destination, completely different job. For Chase, we used it both ways. For him, with his post-workout protein for recovery, and then first thing in the morning on an empty stomach to support his gut health, which had taken a beating from years of anti-inflammatory medications and sport injuries. He did beautifully. He gained muscle and was able to eat so many more foods before he left for college. So it was a win-win. Now, let me give you another example that might surprise you even more. I worked with a woman in her mid-60s who had been exposed to environmental toxins and was dealing with systemic inflammation, significant joint pain, and a body that had become extraordinarily sensitive to almost anything. She was one of those patients where you'd move carefully. Every decision matters. We were talking about digestive enzymes. Most people think of digestive enzymes as something that you take with meals to help break down food. Proteins, fats, carbohydrates. And yes, that's absolutely one of their jobs. Taken with food, they support digestion, reduce bloating, help your body actually extract nutrients from what you're eating. But here's the science that most people miss. When you take digestive enzymes away from food, not at the same time that you're eating it, on an empty stomach, they don't have food to work on. So instead they go into the gut, they get absorbed into the bloodstream, and in the bloodstream they behave very differently. They act as systemic enzymes, helping break down inflammatory proteins. Fibrin, which is involved in scar tissue formation, and immune complexes that can quietly drive chronic inflammation and joint pain. This is actually well documented in research. Systemic enzyme therapy has been studied for osteoarthritis, autoimmune conditions, and post-surgical recovery. There are published clinical trials showing reductions in pain and inflammation markers with oral systemic enzyme use. This isn't fringe science. It's not just not talked about enough. For this woman, taking enzymes on an empty stomach carefully at low dose, building slowly, became one of the most helpful pieces in her protocol for joint pain. Same bottle she could have bought anywhere. Completely different job because of when she took it. This is what I mean when I say timing is half the strategy, because sometimes the same supplement has two completely different therapeutic targets depending on when it enters your body. Okay, I need to talk about something that genuinely frustrates me as a practitioner, not because I'm angry at anyone, because women deserve to know this, and most of them have never been told. Certain medications rob your body of nutrients. I use that word intentionally, rob, because that's what's happening. These medications, often taken daily, long-term prescribed with the best intentions, deplete specific vitamins and minerals from your body. And in most cases, nobody mentions it. Not the prescribing doctor, not the pharmacist, not the follow-up appointment. You just walk away with your prescription and your body quietly starts running low on things it needs, and you are never told about it. Let me give you some examples, okay? Blood pressure meds, particularly diuretics, which are among the most commonly prescribed, deplete magnesium, potassium, zinc, and B vitamins. Diuretics work by making you urinate more, which is how they lower blood pressure. But when you urinate more, guess what happens? You also flush out minerals. I see women on blood pressure medication who are exhausted, cramping, anxious, struggling to sleep. And when we look at their magnesium levels, not just the standard serum magnesium, but the red blood cell magnesium levels, they're depleted. They're not just dealing with high blood pressure anymore. They're walking around chronically dehydrated and mineral depleted because of the medication their doctor prescribed for them. And their doctor never told them this was a known consequence. That's in the literature, guys. There is something super simple they could be doing about it, but they just don't know. And you just don't know. Here's another one. Antidepressants, SSRIs in particular, have been associated in the research with depletion of folate, B12, and CoQ10, coenzyme Q10, among others. CoQ10 is critical for cellular energy production. B vitamins are essential for neurotransmitter synthesis, the very thing antidepressants are trying to support. It's depleting. There's a certain painful irony in a medication prescribed to support mood and brain chemistry, quietly depleting the very nutrients the brain needs to make the neurotransmitters that regulate mood. I'm not telling you to stop your medication. Please hear that clearly. I'm telling you that your medication and your nutritional status are not separate conversations. They belong in the same room. And then, here we go, there's birth control. This is one I feel strongly about, and I want to be straightforward with you. The research is clear that oral contraceptives deplete several key nutrients: B6, B12, folate, magnesium, zinc, and selenium among them. These aren't minor players. Folate is critical for DNA synthesis. B vitamins are essential for energy, mood, and neurological function. But the piece that I think deserves far more attention is this. Oral contraceptives are a known risk factor for blood clots, deep vein thrombosis, pulmonary embolism. This is documented. It's in the prescribing information. This is not controversial. And yet, how many OBGYNs are sitting down with their patients saying, I'm prescribing you this medication. I want you to know it affects your clot risk. And I also want you to know that supporting your body with a B complex can help reduce some of that nutritional burden. How many? My experience, not enough. I'm not here to make anyone feel bad about their medical care. The doctors prescribing these medications are doing their jobs, and I'm here to fill in the gaps because those gaps exist. And women are living in them every single day. One of the things I do routinely with patients regardless of what brings them in, is review their medication list and ask, what is this medication known to deplete? Because that question alone can completely change what a supplement protocol needs to look like. This is part of your health picture, and it belongs in the conversation. Let me come back to Sarah for a moment. She's now 3 weeks into her new protocol. She started low and slow. She's in the Goldilocks zone, or at least she thinks she is. She's taking things with food. She's paying attention, and she comes to me and says, I think it's working, but I'm not sure. How do I actually know? Well, great question, Sarah. Here's what I tell my patients. A real response to a supplement is usually subtle at first. It's not a lightning bolt. It's more like the fog lifting a little bit, sleeping a little bit better, energy that feels a little bit more even instead of crashing at 2 p.m., less bloating after meals, a little more patience with the people you love, hair that seems to be shedding a little less, one at a time. These things are easy to dismiss. Don't dismiss them. Keep a simple log, nothing elaborate, just a note on your phone, a date, what you took, how you felt. Over time, patterns emerge. And patterns, as I always say, are information. On the flip side, if something feels wrong, well, that's also information. Nausea that doesn't go away after the first few days, headaches that are new, anxiety seems to be climbing, sleep that's getting worse instead of better, heart racing, feeling wired when you should be winding down. That's your body talking. And when your body talks, we listen. A side effect doesn't necessarily mean you stop forever. Sometimes it means you're above your Goldilocks zone and you simply need to lower the dose. Sometimes the timing is off. Sometimes a different form works better. Sometimes this particular supplement just isn't right for you right now, and that's okay too. But whatever the response, it's always data. And data is what moves us forward. Here's what I want you to carry out of this episode. Okay? Supplements are not passive. You don't just take them in hope. You take them intentionally, at the right dose, at the right time, in the right form. and you pay attention to what happens next. You think about what your medications might be quietly taking from your body. You ask the questions your doctor may not have thought to raise. And you remember that the label on the bottle is a starting point, not a prescription written specifically for you. Your Goldilocks zone is real, and it's worth finding. In our final episode, we're going to bring everything together. Building your personal supplement protocol, not borrowed from a podcast, not copied from your friend, yours, built from your symptoms, your history, and your data. I'm Dr. Emily Wheeler. Thanks for being here. Your body's talking. Let's keep listening.